everybody, and welcome back to my channel. My name is Beebee, and if this is your first time here, welcome, and if you're back for another video, then welcome back. So today I am bringing you a very highly requested video, the top 10 highest paying non-clinical, non-bedside nursing jobs out there. So I did one of these videos a while back and I got so many questions about it, so I wanted to revamp it, do my research, and give you the ones that are the highest paying. These are the jobs that are going to give you the most bang for your buck in the nursing field, and you do not have to do any type of bedside, hands-on, clinical, nothing. So if you guys want to see what some of these jobs are that may spark your interest, move you into a new career path, then keep on watching. So the first job that pays you the big bucks is working as a legal nurse consultant. So a legal nurse consultant is basically somebody who uses their nursing knowledge in order to assist insurance companies. You help lawyers, you help hospitals in regards to maybe lawsuits or any medical questions that they may have. So as a legal nurse consultant, you can work independently, you can work for a company in and of itself, but you can make upwards of $100,000. Now this is a great option for somebody who has already done nursing. You have a long background, like you literally can fill up your resume with all the types of nursing jobs that you've had and all the knowledge that you have. So a job like this, you don't need to have any type of advanced nursing degree. You can have an associate, a bachelor's, or if you have a master's degree, probably even better. You may have to get certified through the American Association of Legal Nursing, which is a course that you can take online. It's about $400, but once you are certified, you are good to go. So definitely look into that if you are somebody who may want to pursue that career path. Another option that you have if you want to leave bedside is work as an occupational nurse. So an occupational nurse is somebody who works with managers and are on the business side of the healthcare community. So basically what you do is you navigate through and make sure that facilities have safe workplace practices and policies for all its healthcare workers. But with being an occupational nurse, you would provide seminars, meetings, you can go to different various facilities, educating healthcare workers on mental health, physical health, and also dealing with mental issues and stresses that come with working in a healthcare setting. Like I said, this is a great option for somebody who has been there, done that, did the bedside thing, has a ton of knowledge, and wants to give back to their community. So working as a healthcare educator is another one of those jobs that for me, once I leave bedside nursing, this is probably where I would want to go to. As a nurse educator, you are somebody who is going to be using all your knowledge and experience to help future nurses in America or wherever you are. So one of the misconceptions about this job is that you need to have a master's when working as a nursing educator. And believe it or not, certain schools, yes, you may need your master's in order to teach a class such as med-surg, like a lecture class basically, but you can be a clinical instructor at the clinical part, like when you go to the hospital or you go to a nursing home when the students are doing their clinicals. You do not necessarily need to have your master's degree for that portion. So if you are somebody who loves hands-on teaching, this will be a great option for you. And as a nurse educator, you can make upwards of $75,000. This is also a great part-time gig for you. I remember when I was in nursing school, some of the nurses, they would come in 2 days a week and help with our clinicals, and then the other 3 days they still had their bedside jobs at the hospital. Another great option that is not bedside is a I cannot say that word, nurse ethicist. So what a nurse ethicist does is they provide guidance to medical professionals, to families, to patients on the ethical side of nursing. This is a great option for somebody who likes to do one-on-one with patients, but not exactly direct patient care. Like they love the interaction between patients, family members, and all that jazz, but they're not too keen on blood, gore, all that. So as a nurse ethicist, you can help prevent lawsuits. So you're kind of helping things before they happen. You can help families make ethical decisions as far as end-of-life care for their loved one, as well as hospitals. You can help them in the decision-making skills in order to make the most ethical medical decisions. Public health nurse. So a public health nurse is a great option for someone who loves to work within the community, but not exactly at the hospital setting. As a public health nurse, you will be working with the elderly, adolescents, everybody basically, in order to improve the public health. So somebody like that bedside can work for the government, you can work for the CDC, your public health department, and you'll be in charge of creating programs, directing programs, assisting with the development of programs that target specific health problems within a community. With a job like this, they typically pay upwards of $60,000 a year, and it is great for somebody who just generally cares about the well-being and healthcare of the public. Another option for somebody who may not want to necessarily do bedside is working as a research nurse. So what a research nurse does is use information that they gather through statistics, scientific studies, and they use it to implement policies and procedures to assist in healthcare and nursing healthcare. A job like this typically will require you to be a nurse, so you would have to go ahead, pass your NCLEX, and then afterwards you would have to go and get your master's in nursing research. It is something that would require you to do further education, but if you are somebody who is willing to do that so that you don't have to do bedside nursing, this is a great option for you. A medical claims analysis. So this is another great job for somebody who does not want to do bedside. So medical claims analysis basically does what it sounds like. You go through medical claims that may be brought about by healthcare providers, by patients, by anybody, and you review them and you give your opinion as to the validity or if this person legit has a claim. So someone like this can make upwards of $60,000, $70,000. So it's not exactly in the most highest paying range, but it definitely is a great option for somebody who does not want to do bedside. They do prefer for you to have a background in hands-on nursing care, clinical nursing care, but it is not always necessary. Preferred, but not mandated. All right, so the next non-clinical job we're going to talk about is nursing informatics. So somebody who works in nursing informatics basically combines technology and nursing together. This is somebody who will do research within the hospital to help with better patient outcome. A perfect example would be, as a nursing informatics, the hospital may call you in to help them see if there is a difference between the silver point catheters or the alloy point catheters. And what you would do is you would combine all the data that the hospital would give you, and you would come back and assist them in having better patient outcomes. You can also become certified through the American Nursing Informatics Association. That is also a course that you can do completely online for about $400. So you just add that to your RN degree and whatever technological degree that you may have, and you will be A1. So a job like this will make you upwards of $70,000, and there is no bedside nursing and no direct patient care involved. This is also a great option for someone who has been in bedside for a long time and wants to leave, or somebody who is really into technology, who may already have a background in technology but decided to pursue nursing. You can combine those two things and become a nurse in informatics. A nursing administrator. So a nursing administrator is another job that is pretty high paying, and you can literally work anywhere as a nursing administrator. Me, myself, I actually took a year off of bedside nursing last year, and I was an assistant director of nursing, and I'm completely transparent. I made $68,000 a year salary as a assistant nurse, as an director, what was I? So one of the things that you probably want to keep in mind if you are going to be doing a nursing administration job is that it is not going to be 3 days a week for the most part. You cannot always turn it off. You are typically salary, so the ability to make more money by working overtime is not always going to be available to you. But as a nursing administrator, there is no direct bedside needed. You will be more so in charge of other nurses, in charge of implementing policies, making sure that your facility or where you work is in accordance with rules and regulations in healthcare. With a nursing administrator job, you don't have to have a master's or bachelor's. I have my associate in nursing degree, and I was able to secure a job as an assistant director of nursing. And my director also had an associate degree, but she had, I believe, 13 or 14 years of working as a nurse. So it all depends on where you are working and what facility accepts you in that job title. So working as a case manager is another job that is not bedside, and you make pretty good living, up to $80,000. As a case manager, you can work almost anywhere. You can work for this state. You can work at the hospital, you can work in the nursing home setting. So a case manager can do a lot of things. I like this option for somebody who may have worked at the hospital as a nurse for a very long time, and now you're just ready to step away from that, but you still like the idea of having direct contact with patients, with families, and all that. So in the hospital setting, a case manager would be someone who would go to the patient when they are being discharged and ask them what assistance they may need status post-discharge. So if they need walkers, if they may need a home health company to come in and see them, a nurse. Like, as a case manager, your job would be to set all that up to make sure the patient has a safe discharge. You could also do that within a rehab facility. Make sure when they go home, they have all the equipment necessary for them. As a case manager, you also would be working with insurance companies to make sure that patients have everything that they need once they leave the facility. All right, guys, so that is pretty much it. That is the end of my video. Those are my top 10 non-clinical nursing jobs, highest paying that I can find for you. If you thoroughly enjoyed this video, please do not forget to give it a thumbs up. Do not forget to subscribe to my channel. And that is it. I will see you guys in my next video. Love you lots. Bye.